Good morning. It is 9:03. You're watching Breakfast Television in Vancouver. Thanks so much for being with us. Well, Prime Minister Justin Trudeau again addressed the country in what has become a daily briefing during this health crisis. Today, he had more details for businesses and workers on what help they can expect from Ottawa.
If you work for a company that has been impacted by COVID-19, the government will cover up to 75% of your salary on the first $58,700 that you earn. That means up to $847 a week. As I mentioned on Friday, this will be backdated to March 15th.
And Trudeau is again appealing to businesses not to take advantage of the subsidy and warns there will be serious consequences if people do.
I want to offer a word of caution to businesses. We are trusting you to do the right thing. If you have the means to pay the remaining 25% that's not covered by the subsidy, please do so. And if you think this is a system you can take advantage of or game, don't. There will be serious consequences for those who do.
And finally, some are beginning to wonder what all this support could cost the country. Justin Trudeau says his government is putting the health and well-being of Canadians first. He says the country has been saving for a rainy day.
Fortunately, Canada has taken responsible decisions over past many years to have one of the best balance sheets in the G7. We have been making sure that we have money aside for a rainy day. Well, it's raining. And we are now able to invest in Canadians, to support Canadians as we make the difficult decisions needed to get through this and come back stronger than ever before.
And today would have been the day when kids across the province returned to school from spring break, but classes are looking a little different these days. Joining us now to talk more about this is David Zura. Good morning, David.
Good morning. Thanks, Mary. Yes, class is looking very different. In fact, class is looking like there aren't any classes here at Templeton School in Vancouver. We've been here since the early morning, and so far, little good news. No parents have come to try and drop off their kids because classes aren't happening. Now, we took a little walk toward the front door to see what would happen if you tried to get into the school. We did find a couple of little pieces of paper there, taped to the front, essentially urging people not to enter the school, saying do not come in, and then also saying that parents should expect that the school and school board staff to be getting in touch with them and with kids to try and arrange for online learning opportunities. So that is essentially what's happening here. We are quiet here. We're expecting that kids are going to be learning from home. Now, exactly what that's going to look like, we're not entirely sure yet. I did get a couple of tweets directed at me just over the last 10-15 minutes or so, and parents seemed a little bit surprised to hear that something was supposed to be happening online for their kids. So whether or not that's in full effect just yet is yet to be seen. In the meantime, we're going to keep an eye on that, see if we can talk a little bit more online and get a closer picture of what that really is looking like for people in the home right now.
Oh, lots of kings to work out this week for sure. Okay, thank you so much, David. 9:07 here on Breakfast Television. Another long-term care home in Metro Vancouver has been affected by COVID-19. A staff member has tested positive at the Royal Arch Masonic Home in Champlain Heights. Family members of the residents learned the news this past weekend. Vancouver Coastal Health says no residents have tested positive and safety measures are in place. BC currently has 884 people with COVID-19. 52 are in intensive care. Nearly 400 people have recovered. There was no update from the province yesterday. We'll hear from Dr. Bonnie Henry again this afternoon. Well, some of the worst numbers have been reported in Ontario and Quebec, both provinces reporting hundreds of new cases of COVID-19 over the weekend. The total in Quebec is now over 2,800. In Ontario, it's over 1,300. The two provinces have recorded nearly 50 deaths. Quebec has banned gatherings of more than 2 people. Canada's top doctor says this week is critical to see if social distancing measures are working.
I'm certainly watching very closely what's happening in Quebec and Ontario in particular, but also Alberta, of course. All of these areas have had reports of community transmission. I think because of the measures put in, we have to see what will happen next.
Dr. Teresa Tam says she's hopeful about what's happening here in BC, where signs of the illness appear to be slowing down. As healthcare workers work around the clock these days, many are finding parking tickets on their cars after their shifts. An online petition is calling on the province to allow free parking at all BC hospitals for staff as they work on the front lines of this pandemic. The person who started the petition says it's the least we can do to help doctors, nurses, and other hospital workers. The goal is to get 7,500 signatures, and this morning it's quickly approaching that. London Drugs in downtown Vancouver is back in operation after COVID-19 shut it down. The pharmacy was forced to close its location on Granville in Georgia Saturday after one of its employees tested positive. The company says it worked with Vancouver Coastal Health to ensure the location was properly disinfected before reopening yesterday. Well, self-isolating for weeks on end can be tough for anyone, especially for those living alone, which is why a group of BC councillors have come together to offer support for those in need. Ashley Burr has this story.
Isolation can be tough on all of us, with many counselling services closing their doors. But a group of BC counsellors have gotten together to offer free counselling sessions to those in need.
When things are good, let's say, relatively speaking, we're struggling with mental health. So imagine what it's going to look like going forward.
Over 30 counsellors have volunteered so far. Information about the free service is being circulated on social media. Those in need of a counsellor can reach out over email and will receive an auto reply that a therapist will contact them as soon as possible. And if the matter is urgent, it also includes a list of resources for immediate help.
Those 32 or so counsellors that we have right now have access to this account, and if they see a client that they're wanting to work with, based on what they put in that initial email, what they do is simply take ownership over that client, remove that email from the inbox, and then that's their client.
The standard session goes for about 50 minutes, connecting with clients through video chats. Weisman feels now more than ever these services are essential. There have been growing concerns in the counseling community over how the current pandemic could affect suicide rates.
I would bet my house on the fact that it's on the rise. How much on the rise, I don't know. And it's still quite early. So it's going to be just like the virus itself, expanding exponentially. Mental health is going to go alongside that.
Clinical counselor Robin Pittman suggests it's about self-awareness, knowing when it's time to ask for help.
If those first few weeks feel stressful, it's going to. It's normal.
It is 9/11 here on BT Vancouver. We're going to go back to a live shot in Ottawa where federal officials are giving another update. Let's listen in.
À la maison, à moins que vous faisiez un travail essentiel comme remplir les étagères